Okay, can you guys see my screen okay? And you've all been able to get in okay? Okay, so if you guys want to add more concepts to the laundry list of things, like maybe questions or things you found interesting, but someone wrote therapeutic play is a type of play that benefits the child in getting better, like blowing out the flashlight that promotes deep breathing. Yep, that's a good point. I'll also tell kids to like blow out birthday candles, pretend to blow out birthday candles. That's another way to do deep breathing. But good. Someone else found it interesting that in the early years as a child is very aware of who's taking care of them and knowing if they can trust them or not. And then, yeah, 1 teaspoon of food per age was interesting. Yep. Yeah, because you think that that's not very much food. So to just know that it's okay if they're only seeming like they're eating a small amount. Good. Anything else? You guys can still unmute if you want to and add to the conversation. I was going to tell you, I can't remember who asked about me posting the announcements a little earlier. I'll post them as long as you guys promise not to get confused or get upset if you get confused. I'll post them on Thursday. Does that sound okay? I'll have them just post automatically on Thursday at midnight.
Yeah, that's fine.
Does that seem like a fair compromise? I don't want people to get confused because, like I said, I have had instances where people have messaged me panicking, like, none of that material was on this quiz. And I said, well, that's because you were looking ahead. But okay.
Yeah, thank you.
Okay. Yeah.
Yeah, thank you.
Yep, you're welcome. All right, next slide. So this PowerPoint itself will be in the announcements, okay? So this week we're doing preschool, school age, and adolescents, so still covering a lot of material. General characteristics, so preschool age kids, this is from age 3 to 5, right? Think about when kids are in preschool setting. Slowing physical growth, they're not going to be growing as quickly as they were, from birth to 2 years of age. They're getting more refined and mastering their skills more in the areas of motor, social, and cognitive abilities. So think about those 3-year-olds, they want to do things themselves, and that's a form of them trying to master those techniques themselves. Whereas when they were 1 and 2, they were relying mostly on their parents to do things for them. Okay. And in this age group, you think about they're sort of like little people pleasers. They really like to do things themselves, but also they like a lot of rewards or like positive kind of things. Bribery to get them to potty train or things like that. That sometimes is utilized as well, like a sticker chart or something. But they really want to make either their teacher happy or their parents happy by the choices that they're making. So major tasks of preschoolers, so obviously that's getting ready to prepare for kindergarten and school age work. They're starting to communicate more. At 3, they should have at least 3-word sentences that they're saying together, okay? And a stranger should understand about 75% of what they're saying, okay, at 3. By 4, it should be that you understand everything that they're saying as a stranger. That's ideal speech development, okay? They're working on cooperative play, so they're working on playing with others instead of just playing by themselves, parallel play, or playing, next to each other, okay? They're working on controlling their body function, so potty training. By age 3, some kids might be fully potty trained, but most of them, I feel like, are still kind of struggling with figuring that out. And then working on improving their attention span and their acceptance of separation, okay? So they're working on being separate from their parents. Like I said, here is your common characteristics for preschoolers, depending on the age and the types of play that they're playing. Okay. So just to break down, parallel play means that they're playing next to each other, but not interacting at all with each other. Okay. Associative play means that they're all playing the same thing, but they're not necessarily working together with the common goal. Like they might be playing with Legos and one's building a castle and another one's building a fort. The other one's building something else. Okay. So that's associative play. So they're talking to each other and playing the same thing, but they don't want to all build the same thing. Cooperative play means that they're all playing the same thing, talking with each other, and they all have the same goal. So, with the Legos, we're all playing Legos. We all want to build a giant castle together. So let's figure out how to build that. And that's more of a 5-year-old thing. Any questions on the types of play? The other things you guys can read about in this chart.
Yeah. On the parallel play, you said they're all playing, but they're not playing together?
Yeah, so they're playing next to each other, and they may not all be playing with the same thing.
Okay.
So they're playing so I don't know if you've seen 2-year-olds play or 3-year-olds play. Like a lot of times they're not necessarily talking to each other or interacting with each other. They're just kind of playing by themselves, but they're all right next to each other.
Okay.
Does that make sense?
That makes sense, yes.
Okay. Whereas associative play, they're talking together, they're playing with the same thing, but they're not trying to work all together.
Okay.
And then cooperative play is they're talking, they're working together, they're doing the same thing. Okay.
With the same goal, correct?
Yep. Okay. Exactly. Yep. So cognitive development. So remember, Piaget's are cognitive therapists or theorists, not therapists. Piaget, this phase is pre-operational phase. Okay. So they're really egocentric. Think about 3-year-olds. What is it? Mine. That's mine. Me. I do it. Okay. So they're really focused on themselves. They also have animism, which that's giving feelings to an inanimate object. So like a teddy bear or their toy, they start to have human feelings, like that teddy bear's sad, or that teddy bear this or that. They also will say, Teddy's doing this activity, kind of give them the intentions that an adult or a child would do as well. Feelings, giving those inanimate objects feelings and intentions that a human would have. Okay. Artificialism, so that's believing in the environmental characteristics can be attributed to human interactions or interventions. So it's windy outside because somebody's blowing really, really hard. Like, somebody's actually physically blowing and that's causing the wind to be more windy. That's something preschoolers think. Okay. And that's called artificialism. Or, it's really cloudy outside because somebody painted a lot of clouds in a picture and they made it cloudy outside. Okay. So those are things from Piaget's pre-operational phase. Intuitive thought stage. So this is also Piaget, kind of like a subcategory. Okay. This is from ages 4 to 7. So your 4 and 5-year-olds are going to fall into this category, where the 3-year-olds is going to fall into just pre-operational, like your infants and toddlers. Okay. So they're pre-logical thinking. They may realize that symbols represent words or images or ideas, but they can't think much outside of just, okay, that symbol means that. Okay. They're starting to engage in pretend plays. So they're, zooming around with their arms out, pretending they're an airplane, or, pretending to be a mommy with their baby, things like that. Their experience and logic are based on outside appearance. So when they're looking at something and how it appears, they're very much going to take that literally. Okay. So if a parent says something literal, like a figure of speech kind of thing, you know, those kids will really take that literally. Okay. Also, centering is a part of the intuitive thought in Piaget's category. This means they're focused right here, right now. They can't really understand the concepts of past or future at this age. And if they do, they don't understand them like in an abstract way. It's very concrete. So very black and white. Okay. And when they're drawing a picture, you'll see that they'll really concentrate on like one characteristic or one object. Okay. It's like when they're drawing their stick figure, they might draw a nose on every person, but they might not draw a mouth. Like they might just focus it on one kind of thing because they're very concrete in that way. Language development. So delays or problems can be caused. So there's multiple reasons, just like with the infants and the toddlers, that delays can happen. A lot of them are psychological. So things like anxiety disorders, autism, conduct disorders, ADHD, disabilities, learning disabilities. Okay. Those can cause potential language delay or developmental delays. Physiological. So if kids have a genetic syndrome or hearing loss or brain damage from an accident or from, you know, birth, you know, they were hypoxic during birth or something, that can cause developmental delays. Environmental stressors. So if they get meningitis or encephalitis as neonates, that can definitely cause delays, not only from being hospitalized, but from the infection itself. It's a kiddo who has chronic health problems. Like I said, hospitalizations can cause delays because, you know, they're not in that school environment. Okay. Drug exposure, poverty levels, that can affect delays. Malnutrition, obviously, if they're not getting enough nutrition to support their physical body, their language, and their other developmental skills are going to be behind as well. Okay. Now, language is both expressive, so what they're saying, right, and receptive, what they're hearing. Most kids, just like toddlers, can receive or have better receptive language than they do expressive. They understand more of what you're telling them, typically, than what they can express. With 3, 4, 5-year-olds, if they have language delays, it's not uncommon for them to have more behaviors because they have a hard time communicating what they want or need. Okay. So they might be more aggressive. They might be more disconnected, kind of, or they might have a harder time staying on task. Okay. All right. So reflect on what we've learned so far about preschoolers and share 3 like aha, or I didn't know that, or that was interesting moments. And you can just type them in here, or like I said, you can unmute. And I can't see who types what, so don't feel like silly.
I think it's interesting the way that they take things literally. Like, if I say something is cool, and it's obviously something that's not temperature cool, because my son be like cracking up about it, but I get it. It makes more sense now that they think it's literal. So I think that's cool.
Yeah. Yeah. Like if you say something's cool, they're going to go try and touch it and see if it's actually cold. Yeah. Instead of like, that's cool. Yep. Good. Yeah, 3 to 4 word sentences. Yep, 3 to 4 word sentences. And that's usually by 3. And make sure, like I said, make sure you guys know those charts, all those charts of milestones and things in your book. Make sure you're looking at those. Kids work as a group, more like a team. Yep, at 5. Yep. They don't understand sarcasm. Yep. Not at preschool age. They start to get some of that in school age, but very literal, concrete little creatures at 3 and 4 and 5. Anyone else have anything else to add? No? Yes? And yeah, make sure you guys know those, the animism and the artificialism and the centering, like those specific things. Be aware of those. Not that you're going to have a straight up question that says, you know, what is animism, but it's beneficial for you guys to know that, to kind of understand some of the questions that you might be asked. Okay. Good. All right. We'll go on to the next slide. Okay, so your nursing implications. So growth and development, right? And looking at growth and development in the preschool age kids. So hospitalization, that's going to be really scary to them. They're going to think it's because they did something naughty, or for some reason they're being punished. Okay, that's what they're going to view their hospitalization as. They're going to feel abandoned. Even if parents are still there, they're going to feel like, you know, they did something naughty and they're going to be stuck there forever. Separation anxiety. So separation anxiety has stages. So there's the protest stage where they really, you know, want to fight the separation anxiety. They're really angry, upset about it. They're going to protest their parent leaving. And then the next stage is despair. So they're going to be, you know, upset that their parent left them, you know, whether they had to leave them just to go deal with other kiddos at home or they had to go to work. They're going to be upset. They're going to have despair about that, separation anxiety. And then they're going to get to detachment, where they could care less if their parents were there or not. And that's over a period of time. That period of time may be different for different kids. If it's a kiddo that's been hospitalized a lot, then they're probably going to get to the detachment a lot more quickly than a kiddo that hasn't been often hospitalized. Okay, so know your stages of separation anxiety. It's totally normal for kids to regress. Okay, so that means, like, you know, they had those 4 or 5 word sentences and they're hospitalized, and then they kind of, you know, lose that 4 or 5 word sentence, and maybe they're just doing 1 or 2 word sentences, or baby talking, or, you know, they were potty trained and now they're not potty trained any longer. So that's pretty normal to see with kids that are hospitalized. So in your nursing assessment, you should be observing the child, right? So how are they playing? You know, are they interacting with other kids, or are they kind of loners by themselves? Do they prefer like quiet activities, or do they prefer, you know, more loud, active, moving their body activities? Are they communicating with the other kiddos that maybe they're playing with that are also hospitalized, to try and come up with an idea together for them all to play with, you know, that cooperative play? And then what type of attention span does the child have? Now, I will just say, preschoolers, they're not going to have a lot of time in their attention span. You're going to have them focused for a very brief period of time usually. Okay. But you as a nurse should be observing that child and kind of figuring out what you can do to help aid their growth and development while they're hospitalized. Bedtime habits. So encourage the child to have quiet activities like reading or listening to some quiet music before bed. Do not encourage parents to do screen time or things like that up into bed. Don't encourage them to do it at all, but for sure not right before bed, okay? Because that kiddo's not going to sleep well that way. Maintain specific rituals and routines. So that way that kiddo learns, okay, it's almost time for bed. So whether you do a bath and then you read a book, or, do a bath, you get them in their PJs, brush your teeth. Okay, then we read one book and then you're going to bed. Have sort of a routine that's predictable. Preschoolers like things that are predictable because they're literal concrete little kiddos. So attention getting behavior, kids will do what they need to do to try not to go to bed. Whether that's being naughty and they're getting attention for being naughty, or, they're, trying to get attention in other ways by, like, I need a drink, I need this, I need that. And if parents are playing into that and continuing to allow them to do that, then, that's just going to continue to be a struggle at bedtime. Okay. That's where the routine comes in. They know, okay, this is what we're doing. Okay. Rewards can also be like a struggle, but also a benefit. Like I said, sometimes rewards at this age are helpful. So, you can have some sort of agreement. If you guys go to bed at whatever time every day this week, then, maybe you get extra screen time or something on your tablet, or, you get to stay up an hour later on the weekend or something. Okay. But in doing that reward system, sometimes it kind of defeats your routines. Okay. So growth and development. Okay, here's your preschool growth and development. This is, like I said, what you need to know. All of these things listed out here. I'm not going to read all of them to you, but I'll point some specific ones out. So by age 5, they're going to be at 5 to 8 word sentences, usually. Okay. They're not going to be at 5 to 8 word sentences at 3. Okay. On average, they're going to gain 5 pounds and 2.5 to 3 inches a year. They're no longer having that like kind of bigger belly, bigger head appearance like we have in toddlerhood. They're going to kind of thin out a little bit and look taller. Okay. Their right or left-handedness, that becomes established by 3 to 4 years of age. Okay. Learning about sexual identity. So this is a normal stage. So Freud's stage for preschool is the anal stage, right? Because they're learning potty training and all of that. So it's not uncommon for kids at this age to become curious with their bodies, okay? Now, obviously, if masturbation or something like that is really something that's happening a lot, then you as a nursing provider get concerned about like if they're being abused. But you should reassure parents that some of that curiosity is just a part of normal development. Okay. But if they're not only masturbating, but also saying things inappropriately or trying to touch others inappropriately, then that's where you start to get concerned. Okay. Erickson's theory, they're in initiative versus guilt in preschool age. And we'll talk about that. But essentially, that's them wanting to do something themselves. And if they're not able to do that task themselves and accomplish that task, then they're going to feel guilty. Okay. Okay, so bedtime rituals are comforting to preschoolers because why? and pick one of those answers. Okay, there's 18 of you, so I should have 18 answers, ideally. Got about half. Why are bedtime rituals comforting to preschoolers?
My response is the predictable one. I don't know how to respond to this thing.
Okay. Okay. So, providing security. Okay. Not that predictable schedules aren't important at this age, but what the preschoolers is seeking is security, feeling safe, safety in knowing that this is what's going to happen at this time. Okay. Does that make sense? Okay. Okay. So preschool theories. Here's your theorist page. So make sure you know this. Okay. Okay. Phallic stage or anal stage. Okay. 3 to 6 years. So this is when potty training is happening. So think about that. Boys are more attracted to their mother during this stage, while girls are more attracted to their father. This is called optodial complex. Okay. So this goes along with Freud, and you will very much see this, like young girls want to hang out with their dads. They don't care so much about mom. Sometimes that continues into school age and later. And boys want to hang out with their mamas. Okay. Erikson stage, like I said, initiative versus guilt. So this is those 3 to 5 year olds. They're initiating play and activities and new ideas. And if they're not able to do that, then they feel guilty or they feel a lack of purpose, especially if they're being criticized in how they're doing those things. Like if parents or a teacher or someone are saying, oh no, you should do it this way every time. Or no, you're not doing that right. Let me do it. So then they'll really start to struggle with feeling like they don't have a purpose. Piaget, like I said, pre-operational, that's the 2 to 7 year olds. So this is the symbolic thinking. So they have a basic understanding that that symbol means that word or that symbol means that item. But outside of that, they don't read into it very much. Okay. They're starting to learn grammar to express their concepts. But once again, like I said, very concrete. Conservation is developed. So conservation is with pre-operational Piaget's stage is you take one short cup and fill it with an object and one tall cup, but both of those cups are 8 ounces. And kids understand then, or should understand that that's the same amount, even though the 2 cups look different shapes. That's called conservation. Okay. Is that confusing to anyone? Do I need to explain it again?
Yes, can you please just say it one more time?
Yeah, so that kiddo, that 3 to 5 year old, and for Piaget, it's goes all the way up to 7. So 2 to 7 year olds, they're starting to learn that if you have a short 8 ounce cup and a tall 8 ounce cup, they're both 8 ounces. They're both filled to the brim, the exact same, that's the same amount. So they're starting to learn, even though those look different, that's still the same amount. Whereas before 2 years of age, they haven't figured that out. Like if you would have an 8 ounce tall cup and an 8 ounce short cup, they would think that the tall cup had more.
Gotcha. Thank you.
Yep, you're welcome. So Kohlberg, that's the moral theorist, remember? So we're in pre-conventional phase. That's ages 4 to 7. So in this phase, or in this theory, they're figuring out that there's no difference between the right thing and avoiding punishment. Their goal is to avoid punishment, though. So they're wanting to get rewarded versus being punished. Okay. Okay, so common issues in preschool age kids. Thumb sucking. So this is why it's important when babies are little and toddlers are little that they're not thumb sucking. Okay. First off, has a lot of terrible effects on their teeth development. Okay. Especially if they're continuing to thumb suck while they are developing their permanent teeth. Okay. Kids that are thumb suckers, a lot of times they'll automatically have to have braces, especially if they're continuing to thumb suck through, some of their front teeth growing in or bottom teeth. Okay. You should give them praise and encourage them and do some sort of reward system to get them to stop thumb sucking. That's the most, think about where these kids are at. They want rewarded. They want to do well. They want to make you happy. So that's usually the best way to go about that. Okay. Now, if kids are stressed or they're worn out or they're nervous, okay, and they've been thumb suckers, a lot of times you'll see the thumb sucking come back. Okay. So just reassure parents, hey, if they start thumb sucking, okay, you need to figure out what's going on in their environment. Something's going on that they've started thumb sucking again. Okay. Enuresis or bedwetting. So it's more common in boys than girls. Primary means that they've gone their whole life. They've never been a kiddo who hasn't had urinary accidents. Secondary means that they had a period of time where they went a year or more with being dry. And then all of a sudden they start having urinary accidents. Secondary is more concerning typically, because that means that they were able to establish that routine for a period of time and then all of a sudden they stop. So as nurses, you guys will have to look into why that is. So some common reasons are diabetes, okay, a sleep disorder, they're having seizures in their sleep, they have a kidney stone or some other obstructive uropathy, okay, they have an abnormality in their urinary tract, okay, so something anatomically going on, or they have a UTI, okay, or it's not listed here, they're being sexually abused, okay. I know it's hard to think about that stuff with little kids like this, but unfortunately, that's probably about the most common age group. Okay. Okay, so here's a critical thinking question, and I want you guys to just unmute for this, okay? Or if you want to type, that's fine too, but feel free to unmute. Okay, so a foster parent takes care of a 5-year-old child who's required to visit her mother every weekend. The child wets the bed for 1 to 2 nights when she returns to the foster home and then stays dry until the next weekend. Foster mother calls the clinic and asks how she should handle the bedwetting. So how should she handle the bedwetting, and how would you tell her to handle the bedwetting as the nurse?
Well, the first thing would be to limit drinks closer to bedtime.
But do you think that
I feel like it has something to do with the visitation with the mother, because if she's staying dry as long as she with the foster parent and she's wetting the bed, when she goes sees the mother, wouldn't you try to talk to her or
talk to the mother? Yeah, maybe routine wise, there's something different, right? At bio mom's house versus foster mom's house. Maybe bio mom's not, making her sit on the potty before she goes to bed. Or, there's a difference in routine. Yeah. Because obviously she can handle it when she's back in the foster home after a couple days. Also, what else would you be concerned about?
So, could that happen with like the sexual abuse thing
Yep,
as
that
well?
could be yep,
Just
that could be something. Yep. Like I
periodically.
said,
So I'd be
yep,
concerned if there's like a boyfriend or something in the house.
yeah. And I mean, even sometimes it's the
The
parents.
mother, yeah.
Yep. Yep. Definitely worth having that in the back of your head. So, some questions you could ask or some things that you could say is, does she have abnormal discharge? Is she having a lot of redness? Something like that. Is there a UTI going on? Which usually with UTIs, it's not just 1 or 2 nights, every so often. So to me, it sounds like more of a stress kind of thing.
I would say talk to the child.
Yeah.
Exactly.
Yep. Yeah, because a 5-year-old might be able to tell you. Yep.
Maybe it might be some trauma that the child remembers from the mom.
Yeah.
And so throughout those 2 nights, probably it got to the child being with.
Yeah. Yeah, definitely. Good. Yeah, those are all good things. So you want to reassure the foster mom, that, and just tell her to try and communicate. But obviously, if there's more concerns, then she probably should bring that kiddo into the clinic. Okay, good.
I just got another question with that before you move on.
Yeah.
So if you have an incident like that, should you go directly to the nurse and tell the nurse something's going on, or should you try to figure out what the issue is going on, like calling the mother, like seeing what the routine is? Because I know the slide before that you were saying usually it means like something's going on like within the household, like kind of like.
Yeah, so like they have a UTI or something like that. But as far as different environments, the routines might be different as well. So some of that might be a factor. Like, like I said, like bio mom may not have kiddo sit on the potty right before, or she sits on the potty and she says, oh, I don't have to go potty. And then she hops right off. And foster mom might say, no, you need to sit there for a little bit.
Okay.
But like, as far as if there's a concern for sexual abuse, then that's where you need to call your mandatory reporter kind of kicks in, and you need to call DHS and all of that stuff if there's a true concern.
I would also ask foster mother if there are any other changes in kids' behavior.
Yeah. Yeah.
And I don't know if it's appropriate like to involve case manager, because these kids usually have case managers.
Yep. Yeah, or a DHS worker or FSS, FCS worker. Yep. Exactly. Yep. Good. Okay, so health promotion for preschoolers. So they need limits for their behaviors. They don't necessarily like the limits and the rules, but they need them to be able to be successful little human beings. Okay. And to be able to move, further in their development. Kids don't have behaviors, they don't feel safe, or boundaries, then they don't feel safe. They may not like those boundaries, they may not like those rules, but they're really important for childhood development. I'll give you an example. This is an adolescent that came to me, but it works across the board for any age kid. He was in and out of foster homes, and he finally was in a foster home that the foster mom would text him when he was not coming home at night and try and figure out what he was out doing. He said, she's bothering me all the time trying to figure out what I'm doing when I'm not coming home. And I said, well, that's what moms are supposed to do. But, kids can go a lot of their life without having boundaries. potentially. So even something as silly as that, you know, that kiddo made it all the way to like 13 years old and not realizing that that's what parents were supposed to do. Okay. So, I mean, it's really important that kids have boundaries and rules and know that those are the expectations. Okay. So as far as discipline for preschoolers, like we talked last week, for toddlers, 1 minute per age. Okay. And during that timeout time, it's really important to tell parents, like, ignore. Like if they're in the corner throwing the hugest fit during this timeout, just pretend like they're not there until their timer is up. Because if you are interacting with them, or the parents interacting with them and saying like, stop yelling, stop this, stop that, they're still getting attention. So then they figure out that that's how they can get attention. So then that's what they start doing, is, you know, having those behaviors. Okay. As parents, as long as they're in an area where they're safe and they're not hurting others or themselves and they're in timeout, let them throw their fit. Okay. Rewards, like I said, reward system, these kids like rewards. Okay. But bargaining, okay, bargaining with them to do things like, oh, if you don't do this, then you won't get this, then that's gonna not necessarily be the best thing. But make sure if you're doing a reward system as a parent, or talking with a parent about doing a reward system, that they aren't, if the kiddo's still having that behavior, they aren't still rewarding that behavior. Because then they'll just figure out if they can push this button on parent until they give up and they still get their reward, they'll do that. Because kids are super duper smart, even in toddlerhood and preschool age. Okay. Making sure that those parents are modeling consistency and, you know, good behaviors as well. If preschoolers are watching parents yell and scream at each other when they're trying to have a conversation, then that's what that preschooler is going to think is okay. Okay. Preschool programs. So these preschool settings, you know, not every kiddo goes to preschool, but it's getting to be where more kids are going to preschool. So these are structured activities. They're learning group interaction, they're learning social skills, they're learning coping skills, because there's a bunch of different kids that they have to deal with, different personalities, but they're also learning self-confidence and positive self-esteem. Okay, if they're in a program that's reassuring them. Okay, how do we prepare a child for school and engaging in cooperative play with their peers? Like I said, you can unmute or you can just type.
Do you mean like encouraging them to share?
Yep. Yep. Yep.
I would say like socializing, like even if they're in pre-K, they'll, you know, be exposed to socializing with others.
Yep.
And going to the park or something and playing
Yep.
with kids. That will prepare them for going to school and, you know, knowing how to, you know, all fit in together and share. And
Yep. Yep. And kind of in preschool, usually it's more structured, right? So they may not have it as structured as, you know, if they're in kindergarten, but they're going to kind of know, like, okay, we have a snack and then we go play and then we do this and then we go have lunch and then we do this and then, you know, so that kind of teaches them, gets them ready for the school, the structure of school as well.
teach them routine.
Yeah, exactly. Yeah, having play dates outside of school, that definitely can encourage the cooperative play, rewarding good behaviors. Yeah, encouraging siblings to play with them. Personal space. Yep. Respecting others. Yep. The other thing too is like, you know, not all kids have the best behavior. And some kids might get into preschool and they're like, holy cow. You know, I didn't realize kids could behave like that kind of thing in their own minds. So they have to learn kind of coping skills to manage, to know how to figure out how to manage those kids who have behaviors as well, and continue, you know, being successful in their little schoolwork. Good. Okay, accident prevention. So accidents are a huge threat to 3 to 5-year-olds. So car safety is essential. So these kids need to be in car seats. Ideally, some will still be rear facing. So what I usually tell parents is max out the height and weight in each setting on your car seat. That's the safest way to do it. Even if they're crisscross applesauce, you know, in the back, like have their legs all folded up and look like they're terribly uncomfortable, rear facing. If they're less than that weight on that car seat, or the height on the car seat for rear facing, I would have them that way. It's just safer that way for them, okay? If they are, you know, 4 or 5, then probably forward facing with a 5-point harness. Most 5-point harnesses now can go up to like 60 pounds. So, I mean, they should be in a 5-point harness forward facing or rear facing for as long as possible. That's their safest way to ride. Okay. Burns are pretty common in this age group because they're curious about their environment. So telling parents to cook on the back burners of their stove. So that way, you know, they can't just easily reach up and grab the hot pan of oil or water and spill it on themselves, or touch, you know, after we've taken the pot off of the hot burner. Okay. Poisonings, okay, because they're more free, like, you know, you're not right there with them all the time as they're into preschool age group. They're wanting to do things more themselves. So they may, you know, they like the taste of their gummy vitamins. So they might just go and help themselves to 50 gummy vitamins. Okay. So telling parents that having those up high where kids can't get to them. Yes, there's child-proof locks on all of those things, but most of the time it's more parent-proof than it is child-proof, I think. So they will climb, you know, to get those access to those a lot of times. So stranger danger, okay, so that should be discussed. Making sure that they're not playing in secluded areas alone or with other little kids, to where they could be easy targets, you know, for people who are kidnapping or things like that. Okay. And indirect supervision may be necessary due to poor judgment. So some parents may have to figure out, okay, I really have to still keep an eye on my kiddo. Okay. But encourage them to make it seem like they're not right there next to that, like a helicopter parent. Have you guys heard of that term? Right? They won't let kids do anything. They won't let kids kind of explore their environment because they're nervous that they're going to get hurt or something bad's going to happen.
That's being real bad.
Yep. And some of us are guilty of that ourselves, and it's just hard to not do that. But you know, that indirect supervision is going to be really important in this preschool age because they're trying to learn how to manipulate and interact with their environment. And if somebody's right there to save them every time they're making a poor choice, then, you know, as they grow up, they're going to continue to need that. Okay, why are toys such as crayons, blocks, books, and large puzzles good choices for preschoolers?
I would say it allows them to be creative.
Mm-hmm. Yeah, good. Fine motor stuff too, right? Yeah. And gross motor, like with the bigger puzzles or blocks. Creativity, yep. Yep. Helps with their attention span.
Safety.
Safety, yep. Coordination, hand-eye coordination, yep. Good. And all of those things are safe for preschool age kids, right? For the most part, right? Unless kids have a developmental delay, you know, maybe it's a kiddo who has Down syndrome and, you know, they're putting a lot of things in their mouth, or, you know, you get concerned about them swallowing blocks, or, you know, things like that. So just think about also not only the age of the child, but the development of the child. Because if they're delayed, they may still need, you know, 2-year-old kind of toys or infant toys even. Okay, good. Yeah, cognitive thinking, fine motor skills, safe play. Good. Okay, why are toys such as jacks, marbles, scissors, and dice hazardous to preschool age kids? Yep, choking. Sharp, yep. Injuries, yep. Incidents, yep. Dangerous, yep. Yep. Sticking in ears, yeah. Sticking up nose. Yep. Good. Okay, now we're going to go on to school age. Any questions about preschool age kids before we move on to school age? So your exam will cover infancy through adolescence. That's a lot of stuff. Okay, that's why I'm saying this exam is tough, okay? So make sure you're doing an exam review, make sure you're using your study guides. I don't want to try and really stress you guys out, but I feel like other terms, maybe I haven't stressed it quite as much, and others have really struggled, okay? All right, school age. So school age is 6 to 12 years, okay? That's your age range. Like elementary school, kind of towards the start of middle school. Okay? So they're more engrossed with facts versus fantasy. So they're interested in role playing, learning about their environment through play, especially if they're younger school age kids. You know, they know that mommies do this and daddies do this, or vice versa, usually. They're developing their first close knit peer group friendships. Okay, they're starting to develop with those. They're starting to maybe do things outside of school with those peers. They're also starting to do like sports, right? Team sports, and learning and interacting with other personalities. They're judged by their performance, right? They're judged in school. You know, they get grades in school. They're judged in their sports. They have a sense of industry, which means like they want to develop their industry, like they want to accomplish their tasks. They want to get really good at their skills, really good at their sports, really good at those friend relationships. And in doing that, that encourages and builds their self-esteem. Okay. And if they're struggling with those friendships or in the sports and things like that, then they're going to struggle with having positive self-esteem. Okay. Progress from the skill of writing and reading to understanding what is written. So that just from writing from memory versus like understanding what they're reading and what they're writing. They're working towards more of a delayed reward, right? Instead of, you know, an instant good job every time they do everything. Okay. And parents a lot of times need to be guided to understand that kids being unsuccessful multiple times, or parents having really, really high expectations for kids in their academics, but also in their sports, can sometimes lead to them not wanting to do those things at all, or not wanting to try because they're scared of failure. So there's kind of a fine line between parents guiding them to do those things and be successful at those things, but also not being so critical of them. And same with teachers and things too. Okay, so physical growth, their GI tract is more mature, so they're going to have a larger capacity for their stool, and they will be able to eat more and all of that. But their caloric needs decrease because they're not having that huge growth that they're having, prior to 6 years of age. Size does not correlate with emotional maturity. So that means, like, even though they look like they are 12, they look like they're 12, that doesn't mean that they're mature like an average 12-year-old is. Okay. So some parents will say, you're 12, you should be doing this by this time yourself. You should be getting yourself up. You should be getting ready for school. You should be setting your own alarm and all this. I shouldn't have to wake you up. Well, they're still 12. Okay. Parents and children should set realistic goals and expectations and be in agreement with that related to school tasks and tasks at home. They're going to have heightened awareness to their attention problems, right? So they're going to start to notice, like, hey, I'm having a really hard time at school now because, I have ADHD and my meds aren't working, or this or that. Or, they have a really hard time getting to school on time, or they're feeling lonely, they're feeling depressed, and telling parents to, encourage that to be spoken about in their family, and for it to be okay to talk about all of those things with parents. Or if they don't want to talk about it with parents, somebody at school, like a guidance counselor or something. Okay. And homework is the responsibility of the child in this age group. However, 7-year-olds aren't going to come home and say, okay, mom and dad, I have this, this, and this to do tonight. As parents, we're going to have to kind of work through that with them. Okay. But we shouldn't be doing the homework for them. Okay. So general characteristics, gender identity and sexuality. So sexual role development is influenced by the parents and the families that they're used to. Okay. There's also influence of the school environment. So aggressive behaviors is, typically more acceptable in boys versus girls. Okay. They are noticing, like, typical masculine and feminine attributes, okay, in others, but also in themselves. Okay. The other thing is, and you see this with older school age kids, but not necessarily younger school age kids, is, they're talking with their friends and there's a lot of slang terms, or, like, I don't know, kids are saying like bussin' and all kinds of stuff now. That is like way over my head, but I hear about it at work from them. So, like, trying to instill in them, okay, if you want to talk like that with your friends, that's fine, but also we need to know the true terms for things, so that way there's no confusion. Okay. So as far as sexual education in school age, obviously they need to realize that that's a lifelong process that's happening. Questions should be answered in simple, straightforward terms so that there's no, like, confusion. Should be using correct names for genitalia. Okay, I cannot tell you guys how important this is. From the moment that child can speak, they need to be using anatomically correct terms. Penis, vagina, okay? Because if there's a situation where they're being molested or having some sort of sexual assault or sexual abuse, and they call their vagina their pee-pee or their cookie or what, I mean, there's a gazillion different terms for it. that will not be able to be disputed in a court. So then likely that those charges will not be filed. Okay, so it's really important to teach kids the correct terms. I know in some families and cultures and all of that, that's kind of frowned upon, but it really is important, especially if there comes up something that there's some sort of sexual abuse going on. And letting parents know that private masturbation is a normal part of childhood development, but encouraging kids to do that privately and not, you know, in public. Okay, so critical thinking question. A shy, reserved 8-year-old child tends to isolate himself from other children and doesn't want to be part of the group. What type of intervention or guidance can the school nurse provide? You guys can just unmute if you want.
I would say talk to the child, because you'll never know if the child is being bullied.
Yep.
Other kids, and that's why they're isolated.
Yep. Or maybe something's going on at home where they're kind of just bummed out and not wanting to interact with anybody. Yep.
And I don't know where I read it at, but they said like if I want to say it was somewhere in the book or something, if the child has like ADHD, maybe if it's not being treated correctly, they'll isolate themselves.
Yep. Yep. Definitely could. Especially because kids with ADHD, like as they get older, their peers and their classmates get annoyed by them. I mean, that's just the flat out truth. Like if they're really impulsive and they're saying a bunch of things, like as they get older, they get really irritating to other students. So then you see them isolate.
I would
So that
say
goes
like
along
look
with-
at I'm sorry. I would say like look at other things too, not just the shyness, but if the child has clean clothes on, if the child has lunch every day, because sometimes you know, there's other things besides just not wanting to be involved that is a sign of problems at home.
Yep. Yep.
Yeah.
So if kids are just being, if they're just being kind of shy and they're not like wanting to interact with other kids, what could you as a school nurse encourage teachers or the other students to do to kind of involve that kiddo?
Maybe like place them in groups to do like group work activities and stuff.
Yeah, which kids hate that, right? And even us as adults, we're like, oh gosh, I don't want to be in a group activity. But it really does encourage involvement and help to develop relationships too. Yeah, good. And, you know, of course, if they disclose that they're being bullied by somebody, making sure that interventions are being done in regards to the bullying as well. Yeah, assigning groups over picking their own partner. Yeah, good point. Because, you know, those kids that are more shy and reserved, they might be one of the last people to get picked. And then that kind of is defeating the purpose of having a group. Good. Okay, here's their growth and development. So they're no longer egocentric. They're kind of thinking more about the social awareness of others. So they're thinking more about what their peers are doing and what their peers think, okay, versus themselves, being all about themselves, okay? They're losing their primary teeth and they're getting their permanent teeth, okay? Erickson's theory is industry versus inferiority. So they're accomplishing those tasks, they're getting good feedback on accomplishing those tasks, and if they're not, then they feel inferior to everyone else. Okay. Learning cause and effect, so they're not so concrete. They can have some kind of abstract thought. Okay. So know that chart. Okay, school age theories. Freud, this is latency stage, so this is ages 6 years of age until puberty. So kids are spending more time with each other and interacting mostly with same-sex peers. Okay. Whereas in the phallic stage or the anal stage, right, it was that they were interacting more with their parents of the opposite sex. During latency, that switches to they care about same sex, like friends interactions. Okay. Erickson's, like I said, industry versus inferiority. This goes from age 5 to age 13. Okay. They're developing their social skills. They're working on teamwork, and they're wanting to be recognized for what they've accomplished. And if they cannot be recognized, or they are not recognized, or they can't get those skills developed just exactly how they want, then they feel inferior to the others. Okay. Piaget, this is concrete operations for this stage group. So they're still concrete in situations, but they're starting to understand more time, space, quantities. They can understand that in different situations, and they can apply that. Okay. But they can't think of an individual situation or an individual concept and like talk through that as a futuristic, abstract thing. Like I said, they're starting to get some abstract kind of thought, but they're still not totally understanding abstract, kind of out of the box thinking. Okay. Kohlberg, moral theorist. Okay. Effort is made to secure approval and maintain those friendly relationships with others. They want that good girl, good boy kind of reassurance. Okay. They're focusing on fixed rules. And their purpose of morality is maintaining their social order. So maintaining in that friendship group. Okay. They're focused more on interpersonal versus this society. Okay. Okay, so play. So they're going to be more physically active. They're going to have more intellectual skill development and some fantasy, kind of abstract thoughts, like I said. This is where you start to see team sports. They're starting to be more competitive. They're enabling kids to feel, in control and powerful, and learning those environments, but also interacting with other kids on a team. Okay, and mastering those skills give those kids a sense of accomplishment. Okay, latchkey children. So these are kids that are subject to a higher rate of accidents. Okay. These are kids that are kind of like, oh, they kind of just take care of themselves. Parents aren't super duper involved. They're kind of left to fend for themselves. So they're more at risk for being isolated, feeling isolated and alone. More accidents because there's not a lot of supervision. Like, so years ago, when I was a kid, it used to be, we didn't have phones. So we knew we had to be home by the time the streetlights came on. But during the time after school till the streetlights come on, we were kind of just on our own. So that would be latchkey children. Okay. There should always be a backup adult for these kids other than a parent to be available in case there's an emergency.
So you said the risks are just feeling isolated and alone? Is that what you said?
And accidents, like they're more at risk because they're not being supervised, essentially. And you have to think this is school age kids, but it can, latchkey children can be like across the board, like into adolescence. But as far as school age kids, they might stop and go to the park and potentially be in a compromising situation there. Okay. So just encourage the parents to not only have themselves as a contact, right? But they should also have another person that they can get a hold of if they need to. Okay. So what's some safety things for latchkey children?
Have a good safety contact.
Yeah. Mm-hmm.
Maybe have like a code word if someone else is going to be picking you up.
Mm-hmm.
Talk to them about stranger danger.
Yeah.
Talk to them about not cooking when they're at home. If they're at home by themselves, they can't use the stove.
Mm-hmm. Yeah, now that kids have phones.
What, play in a specific area? Like you can't leave out this area or something like that?
Yep. Someone said now that there's phones, it's easier to communicate changes in plan. Don't open the doors for strangers. Yep, if they're having to be home for a while, making sure that, hey, even if the UPS guy is dropping off a package, don't be opening up the door.
I was gonna say, like, testing them too. Like, if they think that you're going to work one day, you leave, and then just like pop back up on them, try to like get in to see if they come to the door, stuff like that.
Yeah. And I mean, unfortunately, in my opinion, most kids have phones now at like 8 years old. So there's easier communication. But yeah, don't tell anyone you're home alone, right? Don't go and broadcast to all your friends that, you're hanging out all by yourself, at the park, saying that out loud to all your friends. Yeah, good.
I would say tell them not to give out like any personal information, like when they're on like video games and all that stuff.
Yep. And if they do have a phone, have all the safety restrictions, like, they can only get a hold of mom, dad, grandma, grandpa, these couple friends. A parent should have a lot of restrictions on their kids' phones, devices, and they should not be on social media, in my opinion. I don't think kids need phones, but that's just not the days that we live in now. Okay, health promotion things for school age. So routine health exams. So these are these kids that are more physically active, so they're needing school physicals for sports. If they're inattentive at school, they're going to be coming in for, a potential ADHD kind of question visit, but making sure that you're assessing the fact that they can hear and that they can see and that they can read and they're not having dyslexia or something else going on that's kind of looking like ADHD. Or maybe they're a kiddo that's just really anxious and they're so anxious and so worried about everything, they literally cannot focus on their schoolwork. Sometimes those kids get thrown into the ADHD category and it's more of a kind of an anxiety thing. Okay. Physical activity helps improve their school performance. Okay, so teaching kids to be physically active is really beneficial. Now, if they really like playing Minecraft or what have you, okay, you can have some time maybe to do that, but we also need to be physically active. Considerations with hospitalizations in these kids, they need simple explanations for their illness. Okay, needs to be broken down in a way that they can understand as school age kids, so ages 6 to 12. They need a time and a place to study to keep up on their schoolwork so they're not falling extremely behind, and that's causing a lot of stress for them. You can also, make some tasks or some assignments for them to do if for some reason they're not able to get their own school assignments. Okay. But they're also learning to take responsibility for getting their own homework done too. Pet ownership. Pet ownership. So pets have close contact with children. Pets obviously can have different diseases. Okay. So you get concerned of if they're having a lot of interaction with your children and that kiddo's sick a lot, that maybe they're getting some, maybe they have an allergy to that dog, or something like that. Kids with disability, though, really benefit from interacting with pets. Okay. And kids who are ill, like in the hospital, therapy pets are some of the most beneficial things for those kids to interact with while they're in the hospital. Something that's really exciting for them. But kids in the school age group are having more responsibilities with their pets as well. Okay. So in having pet ownership, thinking about the age of the child, if they're having any allergies or immune troubles, that can be a huge deciding factor. So if they, have an allergy to a dog, okay, well, then we can't have a dog, unfortunately. We have to get rid of our dog. Or if they have an allergy to a cat, same thing. So thinking about that. Also thinking about the age of the child. If you have a real grumpy old dog that doesn't like to be messed with, and you have a 1 or 2 year old, they're not going to understand that they can't mess with that dog or play with that dog. So just knowing and taking that into account. Infections from pets can occur from their spit, their feces, their urine, or inhaling or skin contact with, potential infectious organisms. Also, don't be having your kid kiss pets or allow them to lick their mouths or lick their faces or sleep with them, okay, in bed, because that's going to be more likely than that they'll have some sort of infection or something go on. Okay, making sure kids are washing their hands too after they're handling their pets. Okay. Questions on school age? No? Okay, we'll go to adolescents. So adolescents, this is good. Oh, go ahead.
It says if inattentive at school should be screened for blank and blank, but I don't understand. Are you saying like
probably hearing and vision concerns, like making sure that they don't have some hearing problem or some vision problem that's causing them to not be able to pay attention?
Okay, thank you.
Yep. So adolescence is ages, so for childhood, okay, it's ages 13 to 18. Adolescence goes into early adulthood, but as far as pediatrics, it's from ages 13 to 18, okay? So this is early into middle adolescence. So they are going through puberty, right? That's a big thing during adolescence. Some school age kids will go through puberty just because of the ages that we're seeing puberty happen now, especially in females. It's more acceptable or more common for little girls to have their menstrual cycles at 10, 11, 12 years of age. Okay. But secondary sex characteristics are being developed in adolescence. They're also, getting to the point where they're no longer growing in height. Okay. But they are maturing emotionally. Okay. They're establishing their identity. They're figuring out what group of friends they're going to fit in, what activities they're going to do, who's going to be their friends. They're figuring all of that out. They're separating more from their family and trying to be, they're trying to care more about kind of what their peers are doing versus their parents and their family. Okay. They're starting to initiate intimacy. So they're becoming sexually active. Okay. or having relationships with others. And they're starting to think about their career choices and the fact that they're going to have to be, supporting themselves. Okay. So major challenges that happen during adolescence, obviously because of the physical and physiological changes that are happening through puberty. There can be a lot of troubles with like hormones and anger and mood swings and all kinds of stuff. So there's a lot of adjustments going on during adolescence. So helping these kids kind of guide and navigate through that as parents, but also as nurses. Maintaining their privacy. Okay. These kids need privacy. If they're coming in to talk to you about because they've been sexually active and they're scared that they're pregnant or they're scared that they have an STD, in most states, it's not ideal for you to talk with parents about those things if that kiddo does not want you to. Okay. Now, talking with parents about preventing those things from happening, that's totally fine. But to disclose things that child does not want you to disclose, unless it's a safety concern for them, then usually that should be avoided. Because potentially with these adolescents, if they've opened up to you about, they think they're pregnant or they think that they have an STD or whatever they talk to you about, if you go straight to their parents and tell their parents about that, they're not going to talk to you again about something like that. So it's important as a nurse that you're a good open book resource that they know that they can come to. Okay. They're learning to cope with social stressors. Oh, go ahead.
So what do you do? Because I don't know how to put it. Like, you withholding information, right? Or no?
So in adolescence, this is what I always say to kids when they come to me for something like that as a provider here in Iowa. If they're scared that they have an STD, okay, that's fine. We don't have to tell your parents that we're testing you for an STD, but they're going to get that on the insurance report. So their insurance is going to get billed for an STD test. So if you're coming somewhere like that, so I'm not going to go straight up to the parents and call them and say, hey, I tested your kiddo for an STD because they've been, having sex with whoever. Because that's going to violate the privacy of that adolescent. But if there's a safety concern, like say that this kiddo's having sex with somebody who's over the age of 18, okay, that's a safety concern. So then I'm sorry, but parents have to be involved. So I just explained that things are between us as long as there's no concern for safety. Okay. Problems. Now, some states have varying laws on that, but like in the state of Iowa, related to birth control conversations, STDs, pregnancies, mental health things, those can be all private between the provider or the nurse and that child. Okay. In some states, there's different rules, but most have kind of adapted that sort of rule. Like unless there's some concern for safety, then they can just kind of talk with you about it. But like I said, doesn't mean parents aren't going to find out through insurance.
I have a question. From what age adolescents can go to the doctor without parents' consent, like just by themselves?
So that also varies. So I usually say if they're under age 18, they still need parents to say it's okay for them to go to the doctor. Now, if it's related to something like pregnancy, STDs, mental health, then there's kind of some fine lines in there that they can come to you as a provider or as nursing staff or as a school nurse, like depending on your role, and see you without parents' consent. But like I said,
is that like different state laws? Like
yes.
where?
Yes. Yeah. So there's different state laws on that. Yeah.
Okay.
So you guys won't have to know like different state laws. Essentially what you should know is you should really try to maintain privacy with adolescents, because like I said, if they come to you and they say, hey, I'm concerned that I have an STD, or hey, I'm concerned that I'm pregnant, and you go straight to their parents and tell them that, they're not going to ever have an open, honest communication with you again. Okay?
But I mean, they cannot receive treatment without parents' consent till age of 18, right?
Like I said, it's different
Okay.
based on the state for different reasons. So like for pregnancy, if I have a teenager that comes to me that's 14 or 15 and she's pregnant, she can still receive treatment because now she's pregnant. So she's essentially considered no longer a minor. But it's too hard for me to say like, okay, at this age, they no longer need consent, because it's so different at each, with each state. So just know for more of those like sexual things or mental health things, based on each state, there might be different age ranges that kids can get treatment without having to have parents okay at all. Okay. But for the most part, yes, age 18 or less, they still have to have parents say it's okay that they can come to the doctor and sign off on those things. Like for vaccines per se. Okay. Okay, so maintain open communications with these kids. Soon as you are deviating from that, adolescents can then really start to struggle, and you can break that kind of trust with them. Push them to develop positive healthcare choices and lifestyle choices. So, you know, obviously safe sex practices, all sorts of things in that safety kind of and healthy lifestyle choices. Physical activity, you know, all of that. They're surging towards independence. Okay, so that's becoming a lot more pronounced that they're independent. They're trying to make their own choices. Like I said, they're trying to figure out where they're going to fit in the world. Okay, they have a lot to figure out with their career and all of that. Difficulties between the adolescents and their parents, because once again, they're trying to explore where they're going to fit and they're pushing those boundaries with parents. So there can be a lot of headbutting between adolescents and parents. Bodies are changing rapidly. Because of their hormones, they may experience more intense sexual drives, so they might be making more risky sexual decisions too. Conformity is one of the strongest needs of adolescents, so they're trying to conform with the environment that they want to be included in. So, you know, if they feel like they want to be, you know, one of the popular kids, they're doing all the things that other kids that they think are popular are doing. They're really trying to fit in. Okay. Okay, physical development. So age of puberty varies. It's earlier in girls than boys. Okay. Like I said, typically in girls now, the average time frame is 10 years of age. Okay. For boys, they're a couple years after, so probably closer to 12 to 13. Okay. They're long-legged and kind of gangly looking. They're not like proportionate. They have some asymmetry going on. And different body parts mature at different rates across the board. The major cause of weight gain is because of increased skeletal mass. I have to tell so many kids that they're like so upset about their weight gain that they don't understand that that's because their muscles weigh more than, you know, fat. So their muscles are getting really refined in this age group. Sweat glands are very active, so they're going to have more acne. They're going to have more, you know, sweating through their shirts if they don't put on deodorant. So talking about those hygiene things with these kids, and then acne, treating their acne. making sure that they're doing face washes, morning and night, so that way they're not getting more acne because of their oily skin. Okay. Okay, Kaylee shared that in Alabama it's 14 for the consent age there. But like other states, like I said, it just varies for each state. Okay, Tanner stages. So this is looking through puberty. So this is somebody who's fully through puberty, okay? A female. So breast development is a part of puberty, and then pubic hair development is a part of puberty as well. Same with males, okay? So as they progress through puberty, they'll have these changes, and that's kind of how you can work with parents and the kids about letting them know, okay, probably within the next year or so, we're going to have a period. Okay. So at the end, that's Tanner 5. Okay. So you start at Tanner 1, Tanner 2, Tanner 3, Tanner 4, Tanner 5. Okay. Most females are going to get their periods at Tanner 4. Okay. Piaget's cognitive development, remember? So we're in formal operations in adolescence. So we're developing systematically, sequentially, and orderly. So it is very much in a stepping stone pattern, typically for formal operations. They understand, okay, I need to do this, to do this, to do this. There's still concrete thinking, but they're thinking also more abstractly. They can't think like totally outside the box like an adult can of all the possible things that may go wrong or may go right, but they're starting to kind of think about those things. Older adolescents can view situations from many different viewpoints because they've kind of navigated through it, whereas younger adolescents, they're still pretty minimal in their viewpoints of different situations. Okay. Nurses must focus on concrete issues and concerns when teaching early adolescence. So you have to be pretty black and white with kids who are in early adolescence. With later adolescence kids, you can be a little bit more abstract about things. Okay. They need to be able to sympathize and empathize with others. Okay. So understand others' feelings and how they would feel that way. They can understand their own values and their own actions. They're deciding what values they're going to have, what actions they're going to have, where they're going to fit. Okay. And they're starting to understand and accept differing values or actions from others. In school age, they don't understand the difference. Okay. But in adolescence, they're starting to understand differing values. That kind of is where that abstract piece comes through. Psychosocial development, so they're trying to figure out their sense of identity. Okay, so that goes with Erickson. So this sense of identity will fluctuate during adolescence. So depending on what group they're thinking that they're going to fit in, things may change. Their parents may change, their thoughts may change, their viewpoints may change, depending on how they're being molded by those environments that they're thinking that they're going to fit in with. Okay. Sense of intimacy, they're working towards, their own identity, but also figuring out an identity in a relationship. What are those, going to look like? What are our roles going to be in a relationship? What sort of things do I want in a relationship? Who do I want a relationship with? All of those sort of things. Cultural and spiritual considerations may be a part of intimacy as well as their identity. Okay. It's a practice decision making. Families should still take precedence over their personal goals. And that's where you see a lot of that tension, because adolescents think that, you know, their sense of identity and their friendships and all of that is more important than the family's situation. Okay, body image struggles, you see that a lot with kids who are in adolescence, you know, the variation in puberty, that is a part of it. They want to look like their peers, they want to be like their peers. So it's really hard if they feel like everyone's looking at them or they don't fit in. Okay. Okay, so reflect on what you've learned so far about adolescence and share 3 aha moments, or 3 things maybe you didn't know.
I feel like with this stage, it's kind of like we already knew. I think the only thing that was like extremely different was the fact that when it came to like the STDs and stuff like that, like a parent is not allowed to know, where we was always taught like a parent has a right to that type of information, especially being under the age.
Right, right. And that is still, like, I will say that still is a struggle for a lot of parents. And I mean, I understand as a parent myself, like I understand, but the fact that that kiddo is coming to that provider is already a really good reassuring thing. So you don't want to cause that to stop, and that kiddo then go to somebody else for information or for help that maybe isn't as reliable. Yeah, girls starting their cycles early. Yeah, parental ethics versus HIPAA. Yeah. Yep, muscle mass versus fat gain. Yep, good. Okay, your adolescence theory. So Freud is genital stage, okay? So beyond puberty, right? So we've passed puberty. So individuals are now attracted to the opposite sex peers, is what Freud thought. Okay, so genital stage. Erickson is identity versus role confusion. So this is 13 to 21 years of age. So goes a little bit past pediatrics. They're trying to figure out where they're going to fit into the world. And like I said, if they are, you know, not fitting in to where they think that they should fit in, then they're starting to become confused and frustrated, and they get stuck with that role confusion piece. Piaget is the cognitive theorist. Formal operations is 11 and up. So they're having hypotheticals, they're having theoreticals, they're thinking about all the things that could happen if they did this or that. They're very abstract logic. They can think about like the pros and cons of things. They're more strategic with their planning. Okay. Concepts learned in the past can then be applied to other topics. Okay. Kohlberg is post-conventional. This is ages 12 and up. So you see that mutual benefit or reciprocating. So like, okay, if I help you, you help me. Okay. Morally right and legally right are not always the same. So they're starting to understand that. And they think utilitarian rules, so, you know, black and white rules make life better for everyone. Okay. All right, common issues. So parenting the adolescents. So it can be very difficult for parents to cope with their adolescents' behavior. Some parents are unsure of their own opinions, so then they may hesitate to parent that situation with their kiddo because they're unsure about, where they feel like they fit, because maybe they didn't progress through the identity versus role confusion. Adolescents need to talk about their fears. So that can be something that's a struggle. They may not feel comfortable with speaking with their parents about those fears, or maybe the fears are from their parents. Needing assistance in sorting out confusing feelings that a lot of, adolescents go through. But they may not come to parents for that. They may go to their friends for that. Okay. The biggest thing is telling parents, even though it seems like that adolescent could care less about your thoughts or talking to you about things, continue to offer that open line of non-judgmental communication to those kids. Okay. I'm not saying not to have rules as parents or expectations as parents, but to know that if that kiddo, goes to a party and drinks and gets drunk, because that happens in adolescence, they can call you as their parent and know that you're not going to be happy about it, but that you'll come and pick them up and make sure that they get home safe. Okay. Okay, critical thinking question. So a parent tells you that his 15-year-old daughter has suddenly entered a period of rebellion and is breaking all the household rules. Last night she came home an hour after curfew with no explanation. She often becomes angry and sullen when disciplined. The parent asks the nurse why his daughter's behavior has suddenly changed, what he can do to stop it. Okay, what would you as the nurse give for advice in this scenario?
That is age appropriate and just set boundaries.
Yep, set boundaries, continue to have those boundaries, right? What else? For adolescents, what's like their lifeblood? Their phones, right? And their social media. So if we're making poor decisions like that and we're not coming home and we're rebelling, one of the best things to do is to limit that access. Right?
Also too, to like get her involved in activities so she has a sense of community. She don't have to go sneaking out to be where her peers.
Yep. Yeah. And as parents, like give and take a little bit, right? So if she wants to stay out because it's a friend's birthday and it's going longer, like than her usual time that she's supposed to be home. Okay, give and take.
Or at least tell them to check in if they're gonna be late.
Yeah. Yeah. Like let me know your car wouldn't start or whatever the excuses may not always be the truth, but have some communication. Good. Okay, so common problems for adolescents, safety related. So, okay, adolescents, they're starting to learn how to drive, right? So wearing seat belts, staying off phones. Motor vehicle accidents are one of the most common ways kids die, in adolescence specifically, okay, or become severely injured. So talking about that as a safety concern. And that can be like driving vehicles can be not only like actual vehicles, but also things like ATVs, so four-wheelers, golf carts. I mean, kids will do some crazy things on some of those. So, making sure you're educating about those as well. Learning how to swim. Some adolescents don't know how to swim. Okay, their friend has a boat. They want to hang out with their friend who has a boat, and they're going to pretend to swim, to know how to swim in that scenario, and then they could drown. So, I mean, safety things like simple like not being able to swim can be a factor for these kids as well. Contact sports, those are going to become more popular. You know, they're going to be playing football or soccer or rugby or wrestling, you know, where they can get hurt. Okay. Eating disorders, that can be really a concerning thing in adolescents, especially if the athlete is typically, you see it more in females versus males, and you'll see they have an eating disorder. So either anorexia, which is they're just refusing to eat at all, or bulimia, where they're eating, and then making themselves throw up. So that way they don't get the nutrition. Also with athletes, you'll see the amenorrhea, or the absence of menstruation. Okay. And then you'll see brittle bones or osteoporosis. So if you're seeing a kiddo, especially a female, like I said, who's really active in multiple sports, you know, they don't really gain weight. Okay. They're not having regular periods, or they haven't had a period by age 15. And then, you know, they're breaking bones often. You get concerned about that kiddo, you know, having an eating disorder and being essentially too active. They need to give their body breaks and make sure that they're getting enough nutrition. Drug use. So obviously the best way to combat drug addiction is by educating kids on drugs and the consequences. Not uncommon that kids will experiment with drugs due to like wanting to be accepted in certain peer groups or peer pressure, or if they're depressed. But obviously discussing those risks with these kids. Adolescents are more prone to mood swings. So if they're utilizing drugs on top of that, they can have some really extreme highs and lows. Also talking with kids about, you know, I feel like marijuana, because it's becoming more legalized across the board, kids think that it's safe and it's okay to utilize, and that maybe, you know, it helps them with their anxiety or what have you, or their depression. But also educating that those kids truly don't know where that, you know, marijuana is coming from, and that it could have other substances in the marijuana, like fentanyl. Okay. Also, marijuana in some people causes psychosis and schizophrenia, that, you know, if they hadn't utilized marijuana, that they may not have activated those pathways. Okay. So your nursing assessments, you're going to look at peers and parents. So you're going to use PACE. Peers, parents, have they used pot? Okay. Or marijuana. Alcohol and automobiles. Are they drinking? Are they being unsafe with their vehicles? This is kind of a safety kind of assessment tool that you can use. Cigarettes. I would put vaping in this category as well. That's really, really rampant in kids, especially in Iowa, but across the board. And education. Okay. So if 2 or more of the PACE letters are problem areas for that kiddo, then they're more at risk for drug use. So if their parents aren't involved, they're smoking pot, then they're going to be more at risk for utilizing other drugs. Or they're drinking alcohol, or they're driving, you know, unsafely. They're not wearing their seatbelt. They're driving high rates of speed, and they're vaping, you know, then that's going to be more risk for drug abuse. And then based off of that, as nursing, you know, you're going to need to be talking about referrals for assistance, potentially in getting those kids off of drugs, or, you know, preventing them from becoming drug addicts. Depression. So drug use can precede the development of depression. So they can start utilizing drugs because they're kind of feeling a little sad, and then it can actually worsen their depression, or alcohol. or cigarettes, all of that. So signs of depression can be a change in school performance, a change in appearance, a change in behavior. Okay. The threat of suicide is always a cry for help that has to be taken seriously without a delay. Okay. So the school nurse can help recognize depression. They can encourage open communication. They can be posting numbers of the available hotlines, like so the suicide hotline, depression and like mental health hotlines. There's all sorts of numbers you can text, numbers you can call. Identifying appropriate mechanisms. So identifying how to identify those kids with depression and what to do with them. If you as the school nurse has identified that risk, and then providing referrals to mental health services, whether that be therapy or medications. Okay, risk factors for substance abuse. Pick which is high risk for substance abuse and which is no risk. Okay, so are parents supportive of my decisions? Is that no risk for substance abuse or is that high risk for substance abuse if your parents are supportive? Okay. So if my parents are supportive of my decisions, low risk. I routinely smoke pot behind the bleachers with my friends. That's definitely high risk, right? I would never drink and drive, or I would never drive after drinking alcohol. That's kind of medium, right? I thought about trying cigarettes when my friends offered, so that's kind of midline too. I get okay grades, but I think school is really hard. So that's kind of midline as well. Good. Okay, so adolescent pregnancy. This occurs while commonly girls are trying to figure out where to fit, in different situations. They're trying to deal with their own developmental issues, figuring that out. And then they can become pregnant. Also, a lack of education. Sometimes that can lead to pregnancy as well. So risk factors for pregnancy, like complications, are the age at which the pregnancy occurs. So if kids are very young, so if you have a 13-year-old who's pregnant, there's going to be more risk that goes along with that. Nutritional intake can be a potential risk factor as well. If they're not taking care of themselves while they're pregnant, they're going to be more likely to have complications. Of course, sexual activity is a risk factor for pregnancy, right? Or limited access to healthcare. So they're not having that access to safe sex education or routine healthcare assessments where, the risks of adolescent pregnancy are talked about. Tasks of an unplanned pregnancy can be broken down into trimesters. So the first trimester is confirmation of the pregnancy. And the second trimester is focusing on the newborn as a real thing. So like, this is going to happen. We have to start prepping for it. Okay. And third trimester then is preparation for the newborn and the birthing process. And as far as like abortions and all of that, I mean, you all know that went back to the states. So when Roe v. Wade was overturned, that essentially means that the federal government doesn't have a rule any longer about it, and it's based on the states. So as far as things related to abortion or birth control and things like that, I can't speak to that because it's different for each state. So you as a nurse, if you do wind up being a pediatric nurse or a school nurse, you will need to be aware of those rules for your state. Okay. So you're not getting yourself into trouble or that kiddo into trouble. Okay. Okay, adolescent nutrition. These kids are very common for having dietary deficits. Okay, they usually have low calcium, low iron, low B12 because they're active, they're skipping meals, they're snacking more, they're eating out more because they can drive, to McDonald's and get their food that they think sounds good. So their nutrition is definitely not the best typically in this age group. Nutritional requirements are more strongly correlated with sexual maturity versus age. So if that kiddo is more sexually mature, they're going to need different nutritional requirements. Vegetarian diets, so that can be something that will throw off and cause some dietary deficiencies that kids may not know about if they are choosing to follow vegetarian or vegan diets. Okay. So high intake in grains, brands, foods rich in oxalic acid can impair the absorption of iron. So kids who are on vegetarian, vegan diets, they're likely going to have low iron and also low vitamin B12. So supplementing those things. Okay. Sports and nutrition, obviously, if they're very active, they're going to need more nutrition. Okay. They're going to have more physical demands on their body. So they're going to need more calories and more nutrition. Okay. Eating a slow absorbed glucose source will help to prevent the development of low muscle energy stores instead of, something super duper high in sugar where like candy, where you're getting all the sugar all at once. Instead of something like fruit where it's kind of more of a slow release glucose. Okay. Caffeine and alcohol deplete the body of water, cause dehydration. Those should definitely be avoided in kids who are active. And anabolic steroids, yes, I see teenage boys, it seems more, that want to take anabolic steroids. But I have had a couple of females that we figured that out. That is totally detrimental to bone growth. So letting those kids know that, they're likely going to be shorter statured. They're going to have growth delays from those anabolic steroids. Okay. Okay, sex education, like I've kind of tapped on this a couple of times. So making sure that kids are coming to you as the nurse for their information, otherwise, or their parents. Otherwise, they're going to be going to their friends and the internet. And as we know, friends and internet aren't always the most reliable sources. So having access to those, not only abstinence, but contraception kind of options, having the education access to those things can definitely help with health promotion as far as sex education goes. Kids will bring up concerns that they feel like they're different than their other peers. They look at peers that are more sexually mature than themselves, and then they get kind of self-conscious. And then experimentation with sexual things as well as, drugs and alcohol is not uncommon in adolescents. Okay. But making sure that they're prepared, if they're going to be having sex, that they have some knowledge on how to be safe in doing that. Because you can't stop kids from doing that, unfortunately. But you can try to prepare them. Okay. Okay, so nursing approaches. So open lines of communication, like I said, provide them privacy, ensure that things are confidential and that you respect them. Hostility from an adolescent, maybe because of, them being fearful. So try to take hostility with kind of a grain of salt from these kids. Rebellion is an effort in trying to figure out where they're going to fit in and figuring out their independence, guiding parents of when to be concerned, the needing to listen and to understand and share their feelings with their adolescents. Okay. Healthcare teaching should include all of these with adolescents. Okay, we've already talked about all of them. Okay, we'll do this critical thinking question and then it's essentially the end of class time because we didn't take a break. Okay. So we didn't get to week 3 material. So what I will do is I will post the link to the week 3 lecture from last term. Okay. So you guys will have that to listen to, and I would very much listen to that before we have our exam in week 4. Okay, along with doing your reading. So I will just post that link under the week 4, or excuse me, the week 3 information. And like I said, I'll change those announcements to post on Thursdays instead. Okay, you will still have a study guide to do for week 3. So as you're listening to that lecture from week 3, fill in your study guide. And then anything you can't get filled in from the lecture, from the PowerPoint, then use your book. Okay. Okay, so a parent of a 15-year-old tells you that his, oh, we already did this. Okay. So theorist review, we'll just touch on this. Freud is psychosexual, okay, and how that, the psychosexual pieces influence your personality development. Erikson is developmental changes throughout life caused by psychosocial factors. Okay. Piaget is cognitive development that's influenced by age and maturity ability. Okay. And Kohlberg is moral reasoning, and that's based on Piaget's cognitive therapy. So Kohlberg and Piaget are they kind of go hand in hand, but they both kind of have their different thoughts. And I posted all of those videos, remember, on the theorists last week. Okay. All of those links to the videos should be there. And they're quick little videos. And that's what's here. Okay. Any questions?
No.
No. I know that's a lot of information. I know it's a lot to know for your first exam. Also, I don't think I've told you guys that as far as the exams go, so like weeks 1 through 3 material is on exam 1. And then for the next exam, it's weeks 4 through 6 material. Okay. So it's not like you're going to have to know everything for every single exam. Okay. That eases your mind somewhat. Now, the caveat to that is developmental tasks and theories, like those sort of things might be kind of asked, or you might have to have a basic foundation or knowledge of that to be able to answer some of the questions related to other systems questions on the other exams. Does that make sense?
Yes.
So it won't be like, okay, what stage is a 14-year-old in cognitive development? But, it might be the 14-year-olds this. I can't think of an exact question, but it might be something pertaining then to something that's going, they have a cardiac defect and you have to know what stage they're in to kind of how to educate them based on managing their cardiac defect. Okay.
Okay.
If you guys have any questions, week 4 is the exam. Yes, we take it at the beginning of class. You will have to have a phone or something with a camera and also your computer or what you're going to take your exam on. You have to have 2 different things. Make sure they are plugged in. Okay, make sure you have reliable internet. You do not be setting something up on your campuses to be on campus to take it in a room by yourself. But you'll still need a phone or iPod or iPad or something and your computer. Okay. Anything else? So those, other than the 5 that messaged me that they were going to be taking the quiz on Friday with Professor Stiles, I have already emailed you in Canvas the link, her Zoom ID and the time and the date to remind you guys that you're going to be doing that. If you were one of the Friday group and you didn't get that Canvas message, send me a message. I might have just overlooked it. Okay. Otherwise, the rest of you guys will be joining me at 8:30 next Monday Eastern time, so 7:30 Central time, to do your quiz too. Okay.
Okay.
The review is
anything else?
The review is gonna be at 9 or 8?
9. The review is gonna be at 9
Central time.
8 Central time, 9 Eastern time. Yep.
Okay.
Don't worry, I have to think about that too because I'm Central time.
Oh.
So 7:30 Central time for the quiz and 8 Central time for the exam review, if you guys are staying on for that. So we'll probably do our quiz. I'll end it when everybody's done, and then I'll join again in my Zoom for the exam review a little bit before 9 or a little bit before 8, depending on what time zone you're in. Okay?
Okay.
Okay, I see your message now, Carmela. I don't know if that's how I said your name or if I said it wrong.
Yes, you said it right.
Okay. Yep. I'll message Professor Stiles and let her know.
Okay, thank you.
Yep, you're welcome. Alrighty, if you guys need anything this week, let me know. Otherwise, happy studying, okay? All right, see you later.
Thank you.
Yeah.
Bye-bye.
Dr.
Yep,
Becker.
bye-bye. Bye. Bye.
Dr. Becker.
Uh-huh.
Can we do the quiz? I know I only missed one, but I just want to know what I missed so I know not to make that same